So it's my pleasure to introduce a colleague from my office in Amarillo who happens to be in College Station today. We're all over the state. Renda Nelson, she's the state program leader for our supplemental nutrition assistance program. We affectionately call Better Living for Texans, and Renda is going to talk to you about BLT and BLT programming and audiences. So Renda, thanks for being here with us.
All right. Thank you. I appreciate it, Andy. And I appreciate this opportunity to visit with all the agents as well as the new Master Wellness volunteers and how we can partner with you all in having a greater outreach for the Better Living for Texans program. As Andy mentioned, this is also the SNAP-Ed program is a program that is federally funded, and we'll go into a little bit more detail to that. But for us at AgriLife Extension, we call that program Better Living for Texans. And so I'll use the acronym BLT throughout pretty much the rest of this presentation. So you have an idea of where we're going on this presentation. So the topics that we will be covering will be the background and an overview of the Better Living for Texans program. We'll focus on BLT, the actual programs and the audiences that we serve through this program, the evaluation process, which is very essential. I probably should add in there, I think, as I've heard throughout the day, the evaluation and reporting of the BLT programs and program series. And then also program resources, some ways that to help you be effective, more effective in the delivery of your program, and some of those resources that we have available through our funding. So I want to start off with looking at the situation in Texas and why the AgriLife Extension supports the Better Living for Texans program. And so when you look at the overall program of SNAP-Ed, we focus in and we identify these key situations, if you will, with regard to our overall population, but then also specifically to the population that we serve through our programs. And so 33% of adults are considered to be obese within the state of Texas. 33% of our youth are identified as either overweight or obese. And then also when we look at the physical activity, less than half Texans meet the physical activity recommendations, and whether they're for adult and or youth. And then also, most Texans are not eating enough fruits and vegetables, and research has shown, Danielle has mentioned, others have mentioned, the importance of eating the appropriate amounts of fruits and vegetables, just for overall health, overall management of certain medical conditions. And so that is one thing that we focus on in this program, thus part of the situation. 16% of households have incomes that are at or below 100% of the poverty level. And so when you look at what the poverty level is, maybe for a family of four, essentially a traditional type family with two parents and then two children under the age of 18 in that house, then what happens is those that's about a household, an annual income of about $46,000. And so at the low, about 16% of our households in Texas are at the poverty level. So keep that number in mind, if you will, for as we a little bit later when we identify our audiences. And then one in six families experience food insecurity. And when we talk about food insecurity, that's the ability to make it through to the end of the month, if you will, with regard to the foods and such that are that you might have at your disposal, whether it be through SNAP benefits, whether it be through other resources that you might have. And so they oftentimes then need the support of like maybe a local pantry or other community agency as well. So if within Texas A&M AgriLife Extension Service, we offer 2 nutrition education programs. And the first one is, let's see here, Andy, it's not one, there we go. The first one is Texas A&M's expanded food and nutrition education program. And that is a federally funded program. And that program is delivered in 11 counties across the state. And those are listed on the screen and in your handouts. The program that I'm going to be and that I work with specifically is the Better Living for Texans program, BLT, and or SNAP Ed. And we have a presence in over 210 counties across the state. So with regard to SNAP Ed or BLT, it's a federally funded program. We get our funding through the USDA's Food and Nutrition Services, FNS, and then they divide that money, if you will, to all the states. And so in Texas, the agency that receives monies for SNAP Ed as well as SNAP funds is Texas Health and Human Services Commission. Within that as well, then it is a federally funded grant program, and so there are the USDA FNS. They develop the guidelines, if you will. And so what you see on the right side of your screen is the picture of the front cover of the FY 2020 SNAP Ed plan guide. And so it is a competitive grant program. States do get varying amounts of SNAP Ed funds. And then, like I said, those state agencies, which ours is HHSC, they identify what agencies, whether it be a land-grant university such as Texas A&M University or other nonprofit agencies within their state, to receive funds to deliver this SNAP Ed program. And so we do run on a fiscal year, a federal fiscal year. And so our programming year starts October 1st and it runs through September 30th of that year. The program is, as I mentioned, it's a grant program. So essentially we have a contract with HHSC, and it's reimbursable for 100% of all costs. But yet we are bound to deliver, if you will, a 10% match hour. And so for every hour that we deliver the program, we are required to deliver, and for every dollar, then that 10% of that match based on the involvement of county extension agents within and extension agents, community support, as well as then master wellness volunteers, as you see listed on the screen. So within that, to structure to stay true to our funders and the intent of the BLT program within the scope, both FNS and HHSC have mission statements. And so FNS's SNAP Ed mission statement is to improve the likelihood that persons eligible for SNAP will make healthy food choices within a limited budget and choose physically active lifestyles consistent with the current dietary guidelines of the USDA's food guidance. And so when you look at that a little bit more and you drill down, SNAP Ed is a service, and we are bound to provide a combination of educational strategies that accompany supporting policy, systems, and environmental interventions, and then also demonstrated to facilitate the adoption of food and physical activity choices and other nutrition-related behaviors conducive to the health and well-being of our participants. And so, again, that's it. Maybe a little bit lengthy, but yet at the same time, there are guidelines. We are required to meet with those guidelines by the types of programs and opportunities that we deliver within our communities and across the state. So when you drill that down then onto into the Texas Health and Human Services, their vision for the program is to educate, connect, and support individuals as they attempt to live healthier lives on a budget through direct education, targeting social, marketing efforts, environmental strategies to encourage healthy food selection, and the use of technology to reach people and communities. And so a few years ago, when I first started in this position, we wanted to be true, if you will, to our agency, AgriLife Extension, but yet we also wanted to be true to our funders. And so a few years ago, we sat down and we carved out what we felt would be best represent the BLT program by developing then our BLT mission and vision statements. And so the vision of the BLT program is to create opportunities, changing lives. And then our mission is to provide research and evidence-based nutrition, health, and wellness knowledge to empower individuals, families, and communities to make positive changes for healthier lives. And so with that, we are, as I mentioned, we are present in 211 counties across the state, which are represented on the blue that you see there, represents those counties where in this fiscal year, we have BLT programs that are being delivered. And then that number usually hovers around 210 counties, but it can, depending upon the staffing, the county agent staffing and such within a county, that might change and shift from year to year. So you might ask, how do we determine what level and what the programming expectations are for a county, as well as the funding that county might receive to deliver the BLT program? And so we use, Texas Health and Human Services has a database where we can go in and we can identify the number of SNAP recipients as current as the previous month. And so when we determine what level for, again, programming expectations and funding, we look at that number, the actual number of SNAP recipients that are in that county. From that, we then base that county's level, and as we often know, is that even though there may be individuals within a county, whether youth and or adult, they may be eligible to receive those benefits, but they are not receiving it. So they're not counted in that number, if you will, of recipients. So with that, we know that the opportunities, the population is such that there would be a greater audience within that county. But nonetheless, that's how we base our programming efforts and funding for each county. So just to give you an idea of FY 2020, FY 19, which we ended on September 30th of 2019, we had more than 734,500 adult and youth educational contacts across the state. When you look at those educational contacts, that could be through educational programs, outreach through health fairs, newsletters, and then also participants within who attend a multiple session program series. Of that, we know that 423,000 we had direct educational contacts. And so that would be those face-to-face type of programs that where individuals come together and we have that set count of that interaction that we track through our programming efforts. And then also, more than 22,900 youth and adults completed the multi-session program series that focused on nutrition, physical activity, and or gardening as well. Of those individuals that we recorded participating in program series, 50% of them, let's see if my slide will advance here. 50% of them were adults, just over 49% were youth, 61% were male, 38, almost 40%, 61% were female, but almost 40% were male. 39% Hispanic, 61% non-Hispanic. 58% had their educational level was at a high school diploma or less with regard to their education. And then when we look at the behavior impacts from the program, and this is overall, so we have moved over the past few years, moved to identify key indicators from as many programs where we teach these concepts to try to tell a broader story of what the BLT program does and the impacts that we have. And so when we look at the behavior impacts of from our participant surveys, half or more of their lunches were filled with fruits and vegetables. And so when they took the pre-survey, it was about 27%. But yet the results on the post-survey, which is usually about 3 to 5 weeks later, there was a 50% of our participants filled half or more of their lunch or dinner plates with fruit or vegetables and fruit. We talk about food resource management, so how to maybe stretch their food dollars. And so with that, on the pre-surveys, almost 40%, they plan their meals in advance. And then on the post-survey, we are over 57% of the participants plan their meals in advance. When we talk about food safety, more than 88% wash their fruits and vegetables before eating or preparing their foods. And then we saw a slight increase on that on the post. So actually we're starting off, at least they're reporting, that they wash their fruits and vegetables before eating and or preparing them. But yet, and so 94%. So we did see a gradual increase on that as well. And then when we talk about physical activity, we saw a slight increase, again, looking at the overall number of our participants where that program series talked about physical activity and the importance of it. They increased their physical activity at least 30 minutes or longer from 4.1 days per week to 4.8 days. So we're getting closer to that recommended 5 days a week with that recommendation. So then what does the BLT program offer? And so the BLT program offers opportunities to help others live healthier lives. It provides, it helps to build confidence in our participants to learn practical cooking and gardening skills. It teaches the importance of being physically active. It offers educational items that reinforce what is taught. And so we call those educational reinforcement items that go along with the content, the information that's being shared. It creates support that encourages families and friendships. And I want you to note something here. Do you see anything where it says increasing the number of fruits and vegetables they eat, increasing the number of days they're physically active? Those are all very important. That's very important information that we know that our participants need to adapt, and that's why we look at those behavior changes. But at the same time, when you think about our audience and what's important to them, these are how we advertise our classes or our programs. This is how we hopefully entice them, if you will, to want to come and be a part of the Better Living for Texans programs. And then by them coming, we're building on those confidences, those opportunities, and creating that trust, if you will. By then, they're able then to hopefully go then and adopt these healthier lifestyle type of changes. So when you look at those identifiers of what's important to our audience, these are the focus areas for BLT. And so again, keeping in line with or within the scope of what our funders outline in the guidance. Our focus for the BLT program is to increase fruit and vegetable intake, to increase physical activity, to increase access to fruits and vegetables. And so we have gardening programs that we have going on, both at the youth and adult levels. Food safety, as we identified with regard to washing fruits and vegetables, hand hygiene, and then also food resource management, as I mentioned earlier, stretching those food dollars through the month so that they are more self-sufficient and on making ends meet, if you will. And then again, those are from our guidelines as outlined for this current fiscal year. So then our program strategy, how do we, and again, identifying our target audiences within that guidance. And so our SNAP participants are indeed low-income individuals. They either are eligible to receive, or they do receive, or other means-tested type of federal assistance programs, whether it be WIC, whether it be TANF, so some other types of programs where they might receive federal, state funding as per those guidelines. We also are able to identify our target audiences of individuals living in communities with a significant low income. And so what they identify, how they identify that now is looking at the geographic area of where our audiences and communities where they might be found. And so when you identify those, it might be like within the neighborhoods of a local school that meets our low-income audience criteria. And so with that, and we'll talk about that a little bit more, how to identify those locations, where those agencies and such might and community partners might be located. But with that, SNAP eligible audiences our primary target still is women and children. They are our primary target, but we do deliver programs to senior adults, older adults, and again, single adults as well, who may not have children or youth in their homes. So when we identify then how that, again, going along with that program strategy, implementing BLT, we look at, there are different ways and different means to deliver the program. So we might identify, or agents, as I mentioned, agents identify, we have, in some counties, we have BLT nutrition educators, but the agents may be county extension agents. They may be extension agents for Better Living for Texans. They might be Healthy Texas agents, health agents that are delivering the BLT program. And so again, implementing our programs with youth and adults. Co-workers might help to administer some of these programs as well. And so especially where we might have a gardening program that's going on, individuals might, like the co-workers, then agriculture and natural resources, maybe a 4-H agent, maybe a program assistant at the county office, they might become engaged with helping to deliver and implement the programs as well. And then, of course, our volunteers, master wellness volunteers, community volunteers, participate as educators or facilitators, and to help identify what those needs are. And there might be some agents who might, or some volunteers who might just enjoy. They feel that their service might be to help prep for a program. Whether it be for a food demonstration, whether it be the paperwork, or maybe helping to input survey data at the county level as well. So when you're going I try to identify those audiences, those participants within your county, I work with and coordinate with your BLT or county agent, county extension agents to help identify those audiences and those partnering agencies. So as we've talked about, BLT does work with a variety of limited resource audiences. As I mentioned earlier, identifying those audiences and or those sites, it would be, think about where low-income individuals, where they might be going to receive food benefits, whether it might be a local food bank, local food pantry, or other areas where there might be they might be receiving other supplemental funding. How we also identify those audiences with regard to identifying individuals in communities where at least 50% of the residents of the population live at 185% of the federal poverty level. So as I mentioned before, about $46,000 is where that poverty line is for our audiences at the 185%. The poverty line might be here, 185% might be above here slightly. So about $46,000 for a family of four is identified as our BLT audience. And then again, those community agencies and organizations that already do pre-qualification for their participants, and that we can go and again partner with them to deliver programs. And then when you're looking at schools where you might want to partner, schools where 50% or more of the students, the student population, receive free and reduced lunches. And so again, that's a federal program. Public school review, about a month or so into the new school year, new academic school year, usually that site is updated with those new with that new data for that current school year. And then of course, any school that has been identified as a Title I school, because of that identification, that school being recognized as a Title I school, that is a place where we can automatically go in and do BLT programs. And then the next slide, just quickly, just to run through as a reference for you and later, some ideas of other partnering agencies where you might identify our BLT audience and where you could serve those individuals and families. If you're not sure, and again, your BLT or county extension agents will work with you on this. But if you're not sure if that audience or that group of folks meet that criteria, we do have a site certification form that can be completed by that agency or that community organization, by the director or someone who coordinates or oversees that program. And then we also have a justification form that the agents and such could help you to fill out, just to make sure that we are meeting within the guidelines of, say, if there were indeed a county review along those lines. All right. When we identify audiences that do not meet our criteria and are specifically outlined in our guidance, are individuals whose income is 185% greater than the poverty level, greater than that percentage. Individuals who are incarcerated in an institution or some type of a local facility. So jails, detention centers, prisons, nursing homes, convalescent centers, mental facilities. Those are specifically outlined as not being eligible audiences for the BLT or SNAP Ed program. Individuals also, so keep in mind that individuals not responsible for planning or preparing their own meals, so going and doing their own grocery shopping, excuse me, they do not qualify for the BLT program. And so that's specifically outlined if you have any questions on that as it being a possibility. So topics that cannot teach or fund BLT, again, we have to keep within the scope of our funders and what is required of that. Our audiences, we cannot teach medical specific type of conditions. Now, we can talk about maybe how this, to help in the prevention of diabetes, high cholesterol, high blood pressure, but we cannot do any type of education that relates specifically to the treatment of those medical conditions. Again, obesity treatment, food safety for retail management establishments, life skills such as debt management, English as a second language. However, say there's a program within your community, and it's an English as a second language class with adults at a local school. You can go in and work with that program, partner with that program to deliver a BLT program in English, which is often done across the state. And so that is an opportunity for you to become engaged with an English as a second language class. However, to not be a part of that actual curriculum in that training. And so I hope that makes sense. But yet you can partner with some of these agencies to deliver BLT programs that might help their clientele in their overall goals. All right, so when we look at what the curricula for BLT programs, it is research and evidence-based. And then also, there are 3 curricula focus areas. We keep true to that nutrition component, but yet nutrition, that might be the main focus of a program series. Physical activity may be the primary focus of a certain curricula. But yet also it has nutrition sprinkled in there as well. And then gardening, again, increasing the consumption and or access to fruits and vegetables through our gardening programs. Again, that nutrition component is always an underlying theme for our programs. So with that, again, as I mentioned, our nutrition-focused programs that we have for adult and youth, some of these are new for FY 2020 that we just started in October. A Fresh Start to a Healthier You is probably one of our more staple type of programs, if you will. It's an adult program, 3 to 4 program series in length, or sessions in length. And again, all of our series have either a pre or post follow-ups, and we'll get to that a little bit more as well later. Get the Facts is a updated version of a Get the Facts program that we had a few years ago, and so that again is a new curricula. Healthier Carbs, that's a tentative. That program is still under development. We're hoping to have it available sometime this spring. But as Danielle shared with regard to the diabetes program that is out there, that is available, that the Do Well, Be Well is not one of our programs that we can offer, again, because of the more treatment that might be associated with diabetes and or the hypertension version of that as well. And so we know that a lot of our population within our audiences, they struggle with pre-diabetes or diabetes, type 2 diabetes. And so we are looking at to develop this program to where we can help them to identify healthier carbs, as well as an overall healthier eating lifestyle. And then our Be Well, Live Well is a program series that is for those age 50 years and older. And so it focuses on nutrition, but yet there's food resource management somewhat in there as well, and then physical activity also. Excuse me again. Youth is Color Me Healthy. This is a program that we adopted from North Carolina State University's extension program, and then also Choose Healthy, which is also a middle school program that we created or adapted from Ohio State University. Excuse me again, I'm sorry. So then our physical activity focused programs are adult. We have the Walk Across Texas with Mike Lopez, shared with you about earlier today. And then also that is for youth as well. But then we also have another, an extension of that program, if you will, that is called Walk and Talk. And so with that, the educator, the agent comes together with the group, and they actually once a week, and they actually walk and talk. It is an 8-week program, and so we have two different program themes, if you will. One is on fruit and vegetable, to focuses on walking and talking about a fruit and vegetable each week. And then the other one is Rethink Your Drink. And so looking at healthier drink or beverage options to, again, going along with that nutrition theme as well. Youth physical activity focused program that also can, about 50-50, if you will, for nutrition. So it could possibly go either way as that primary focus, is the Balancing Food and Play. And that program is currently being updated, and hopefully it will be ready for release, if you will, for new rollout here within maybe later spring, early summer. And then I'm very excited. Alice Kirk and her team have been working on that to get that updated. And so from what I've seen, it's going to be a great program, even better than what it has been. And then the gardening focused programs for our adults, growing and nourishing healthy communities, gardening course, and then also the youth is Learn, Grow, Eat, and Go, which Lisa Middlesley is on, and she will be sharing more about that with you all after my presentation. I do want to say real quick, with regard to that I didn't mention earlier, that with regard to adults and youth, our guidance does distinguish what age is considered an adult and what is youth. So anyone who is 17 years of age and younger is considered youth, and so those would be involved with our youth programs. Anyone 18 years of age and older would be considered adults. Thus, that's how we identify our programming efforts, and also how we report back to our funders with regard to our program impacts and the program series that they have allowed us to implement. So as I mentioned earlier, policy systems or environmental interventions, but affectionately referred to as PSEs, they are very much a part of what our program is about. And so by our guidance, we are required to, that 25% of our programming efforts do reflect, of our SNAP-Ed efforts do reflect PSE. And so when you think about how policy, systems, environmental change, how those might differ, when you look at policy, which we as an agency, we are more of an educational agency, and so we're not involved with the policy change as, say, other nonprofits might be. But we might work with, say, a school board, a SHAC, a local health advisory committee within the schools, to identify better practices, policies that might help, like maybe putting recess or physical education back within the school day, or adding a salad bar to the lunch line. So there are different things that we might be able to help encourage, help be a part of that process, but we're not really that much involved with policy change. Where a lot of our programming effort, especially through BLT, occurs, is through the systems change. And so when we talk about systems change, it's that ongoing, unwritten, often qualitative decision-making type of agenda items, if you will, or initiatives within an organization. And so systems and policy change, they can work hand in hand. We might be there to encourage, or maybe the policy has been set, or been established, and then we might come in then on that backside, if you will, or as an extension of that, and help then to implement those system change, that education, getting the those impacts to help that organization to make that policy come to life, if you will. And so with that, it can be identified through that organization, changes within those individuals, those participants that might be engaged within our programs. And then environmental changes, very much as it is stated there. It includes changes to the physical, economic, social, or maybe even the messaging that goes out, whether through social media, print materials, whatever it might be, those environments within an agency. So again, your BLT or your county extension agents, they can help you to identify what those PSCs look like and how then we report that back to, they report that and then we report that back to our funders. All right, so we're going to move on to the evaluation of our programs. And so with that, with all of our curricula series, we administer either a pre, post, and possibly a follow-up. It depends upon the series, a survey. And then with our growing and nourishing, we administer a retrospective survey. And so the pre-survey is given before you even start that first class. And so you might go in, introduce yourself, introduce the program, then you give out and you have your participants to take the pre-survey. Then the post-survey is given, or the retrospective survey, it's given immediately after that last session. It's not administered at the start of that last session because yours might be still going over delivering information that hopefully they will take with them or that they will learn. And so that post-survey is administered, or that retrospective survey is administered after you have delivered all of the key indicators, all of that key information for that program series. And then those follow-up surveys for a couple of our program series, we do what's called a delayed or follow-up survey, and we administer that, or that is administered about 30 days after that last class, after that post-survey has indeed been collected from participants. And so with that, again, coordinating with those, with your agents on the collection of having those in hand before you even go deliver that first program series. So again, just to recap that real quickly, the collecting of the BLT surveys, again, whether it be pre, post, follow-up, or retrospective surveys, there is a specific survey for each program series. And so for a Fresh Start for a Healthier You, that pre, post, and follow-up survey is only for that program series. Our GNHC, that's where we do a retrospective survey, and it's specific to that program series. Get the Facts has its own pre and post survey as well. And so again, it's important that we keep that in mind when you are prepping to go out to deliver a program. And then the follow-up survey, we use that just to help us to better identify if these behavior changes have increased once that participant is removed or from and no longer involved with that program series. And so again, a follow-up survey can be administered as at a single education, or what we call maybe one-shots. And so again, it's important that we collect those survey, that we use that survey data. We use it at the BLT state office. We report it out to our state legislators, to our funders, and then also to those who are within the county. They might report it back to their stakeholders as well. And then also, again, coordinate that with your agents. And so I want a slide here specifically for our reporting BLT. When you do your Master Wellness volunteer reporting, over the past about a year or so ago, we were at about 25% to 33% on whether it be events, hours, educational contacts, but that's declined a bit. And as I went back and looked at the year-end report for this year, for 2019, I identified a lot of programming efforts that were indeed with BLT, could be identified as BLT programs, but they were just not marked when doing that reporting. And so, if nothing else, I encourage you to, if you're not sure, check with your agent to see if that is indeed a BLT program that can be relevant for that. My time is almost up, if not up. I am going to just briefly highlight the next few slides. Programming supplies, we are able to provide programming supplies. And again, work with your agents on that. And if you're not sure if that program, consider if it's necessary, if it's audience appropriate, and or if it's reasonable. A reasonable cost for our program efforts. We use various recipes, again, that are appropriate for our audiences, considering what their food resources might be. And so those are a couple of websites. Again, work with your agents to see if indeed they are appropriate. If you're planning to use to work with, again, working with your agents, but any of our printed materials that we distribute that might have been copied with them, again, we are required to have add USDA statements as well as some AgriLife statements as well. Then almost done. This is who represents our offices. Again, who you will have most contact with are those at the county level. We have regional project specialists across the state that work with your county extension agents, your BLT agents, and then our BLT nutrition education associates and assistants. And then so last but not least, we do, as per our vision, we create opportunities, changing lives through this program. And to you volunteers, you are truly an extension of our program to help us to reach more families to where they can benefit from what the BLT program does offer. And so with that, I thank you. I've kept an eye on the chat box. I haven't seen any questions. So thank you for all you do and for the difference that you do make and that you will make within your counties.